Welcome to Learning Unit number 10, where we're going to be talking about pain and symptom management at end of life. Specifically, we're going to look a little bit more in depth on palliative sedation. So by the end of this learning unit, you're going to discuss the use of palliative sedation as it applies to client care at end of life, and demonstrate the skills needed to assure that the ethical principles of respect for autonomy and dignity, beneficence, doing good, veracity, truth-telling, and non-malfeasance, doing no harm, are maintained when communicating with patients who are nearing or who are at end of life. So you're going to do a few things this learning unit. I've abbreviated some of what you're doing just to give everyone a bit of a little bit more relaxing week perhaps. So first you're going to read an article, and this article, the quiz will be based on the readings of this article. And I'm asking that you look at pages 1 through 6. This is considered a pre-class reading assignment. Now, this is the Hospice and Palliative Nurses Association, HPNA. So this is a nursing association that is made up of nurses who focus and who are experts in hospice and palliative care. This is the position statement that was developed by this group for palliative sedation. So we're going to talk a little bit about palliative sedation, but please note that this policy statement or position statement of the HPNA was done in 2016. It is currently under review, so it's a little bit late in being reviewed. Typically, they review policy statements every 3 to the longest is 5 years, but it is right now it is under review and revision. But it's so important that I really wanted to make sure that we looked at this position statement. So palliative care palliative sedation is for patients that are alert, they're conscious, and they are imminently dying. So they are in active dying phase. What happens sometimes is that these patients have intractable symptoms. Usually it's intractable pain. That means that it's pain that even though they're really getting expert palliative and hospice care, their pain is not being relieved. So that's the definition kind of for intractable. It is really impacting. They're suffering, and you can see the suffering in those patients. Now, it really doesn't happen with many patients because we do have experts in pain and symptom management, especially in hospice care. But it does occur occasionally, and with very specific, typically disease processes. Certain cancers may have intractable pain. So palliative sedation is sedating a person with specific medications, and its focus, the reason for it is not to hasten death. The reason to do this is to decrease the suffering. So this is approved by the American Nursing Association. It is part of our code of ethics, and it's considered double effect. The double effect is that our intention as healthcare providers, both the ordering physician and the administering nurse, sometimes it is a nurse administering the medication, the intention is to relieve pain. We have a patient who's suffering, the other medications have not been effective enough, to ease this patient's suffering. The patient has agreed to have this palliative sedation. So the intention is to relieve pain. The double effect is sometimes when we're relieving pain and causing palliative sedation, it does, in some manner, can often hasten death. But the double effect, what is ethical and part of our American Nursing Association Code of Ethics, is that our primary purpose for giving palliative sedation is to relieve pain. It is not to hasten death, but the double effect is that sometimes administering the sedation can in essence hasten death. So it's interesting that you look through and understand what the double effect is and what is in palliative sedation. So that information is found here, quiz 11. There is a shorter article on end-of-life pain and symptom management, and you're going to base your discussion board post on mostly this information, but you're probably going to want to add in information on palliative sedation. Then to ease, because this can be difficult content, it can be, difficult to hear about the suffering of others. And this is a humming meditation, and it was done by Sarah Winogel. She is just graduating from our Master's in Nursing in Integrative Nursing Leadership. So Sarah is one of our own nursing students. And she had this video along with her article published in the September 2022 issue of Meditation magazine. So I think you're going to like the Humming Meditation by Sarah Winogel. So the two parts of your discussion board, and if I don't say anything about reply, that means that you do have a reply, but that there's two parts. First of all, summarize and cite the information learned from reading the article, Managing Symptoms at End of Life. And then I want you to just share your experience with the humming meditation. What did you think? So that's week number 11, and I hope that you have another good week.